Hi, Mr. Hall. My name is Sophia. I'm going to be educating you on fall prevention and different techniques that you can use within your own home to help prevent falls. So when we first talk about falls, I have to describe the demographics on falls. So each year, millions of elderly patients above the age of 65 fall every year, whether it's accidental or non-accidental. Some of the fatal injuries that come with falls are broken bones. The most common would be in the wrist or the hip, as well as traumatic brain injuries and head injuries as well. According to the CDC, many patients that become hospitalized each year cost millions and millions of dollars for treatment. Some of the ways that treatment may come for a patient who is admitted because of a fall is to actually treat the fall injury, surgery, outpatient rehab to help recover from the fall, as well as PT and OT consultations for the patient for future follow-up. So of course falls are very expensive, and what we want to do is help to prevent patients from falls so we can help decrease costs and help with better health outcomes for our patients. So when we talk about falls, of course, we want to talk about different conditions that can actually increase the risk for falls. So some of these may include vitamin D deficiencies, osteoporosis, which are more common in women, especially over the age of menopause, as well as having body weakness, fatigue, gait and balance issues, of course. Those are huge ones, as well as certain medications, which I will go more in depth on that a little bit later into this education, and incontinence of bowel and bladder, as well as vision problems, hearing problems, improper pain management, and not a clean home environment. So of course these are all huge things that we have to take into consideration for falls. And also if a patient has multiple interdisciplinary diagnosis besides their primary one for why they're being admitted to the hospital. So with elders and falls, not necessarily all falls are gonna prevent or go into a fatal injury, but that doesn't mean that the patient is not at risk for falls still. So even though a patient may fall and let's say they don't have any injury or don't have to be hospitalized, they may have an increased fear of future falls, which could cause them to have decreased activity and decrease of their ADLs, which causes them more weakness and decreased mobility, which does actually increase their risk for falls. So even though a patient might fall, we don't necessarily want them to not be mobile at all, but we need to take precautionary steps. So when we talk about elderly patients and falls, we have multiple strategies that we like to teach patients, Mr. Hall. Some of these are to help incorporate exercises within their life for weight bearing. So some of these would be Tai Chi, yoga, walking, swimming, which for you, I know that you had been admitted to the hospital because of your arthritis pain. Which caused your falls. So swimming would be a very good exercise for you because it helps smooth out the joints and make sure it's not so rough, but you're still getting in the exercise and movement. Other strategies that we try to help implement for patients are different things that they can do around their house. So removing loose rugs, making sure that they pick up cords or wires throughout their house, decreasing clutter, so not having papers, magazine, books, random things just all across the floor, making sure that the patient has proper lighting within their house, so different lights for stairs or unsteady surfaces so that they can see, and also making sure that the patient has guardrails and railings for stairs as well as within their bathroom for when they're trying to bathe or get to the toilet. So I had seen that your daughter had recently just installed the side rails into your bathroom, so that's a wonderful first step to helping preventing falls. And then another thing that we also love to suggest to patients is making sure that they're moving slowly with each position changes, not moving too quickly, otherwise this might cause dizziness, and to use their ambulatory aids that help them with mobility and transfers. So with talking about falls, of course, we can't forget prescription medications, non-prescription medications. So there are many medication classes according to the Geriatric American Society for their Bears criteria that talks about meds that are higher risk for elderly patients for causing certain side effects. So some of these classifications of drugs are antihypertensive medications, beta blockers specifically, which I saw on your chart that you take metoprolol to help manage your hypertension, as well as diuretics, narcotics, sedative medication, which I also saw that you take Benadryl to help with sleep because you have insomnia at night. Antidepressants, benzodiazepines, and non-steroidal anti-inflammatory drugs, which is a common class of over-the-counter drugs that many patients take as well to help with pain management. So some of the side effects that are more high risk or prevalent within the older adult population that we have to watch out for is mental status changes, unsteady gait, weakness, decreased alertness, increased fatigue, and drops in blood pressure. So those are just common things that we always like to keep track of, which can increase higher risk for falls. And so after talking about the different side effects that medications can cause, which can increase the risk for falls, we want to tell you as to why it's important to empower patients to become responsible on their medication regime. So some of the ways that we like to suggest to patients to help make sure that they're staying on track with their medications is to use a pill organizer box that has pills set up for each day of the week, so you know what meds you're supposed to be taking every day. And so you have that organized, making sure that you're reviewing your meds with your primary care physician frequently to see if there's any changes or medications that they want you to discontinue, learning about the side effects for high-risk medications, which again I had just explained from the Beers criteria, some of the prevalent drug classifications which are higher risk for older adults, as well as making a list of medications prescribed and over-the-counter, so you have a full list and know what you're taking. And so when you're trying to make these different decisions help empower you to learn about your medication regime and responsibility, another thing we like to stress for patients is the importance of continuous medical assessments and physicals. So some of the reasons why this is important for patients is because, one, it helps increase the relationship between the patient and provider so that they're on the same page with the treatment plan as well as secondary diagnoses. It also keeps the patient up to date on what their plan is. It helps with preventing future diseases and helps nip things in the butt quickly and being on the offensive side, as well as with preventative care. In the long run, it actually saves healthcare costs and money for you and your provider because it's less hospital visits, and you're able to detect things more quickly and sooner rather than later. So when we look at all these factors, again, it's very important that you're seeing your primary care provider regularly and that you're up to date on what you're taking, because knowledge is power, and you want to make sure that you know fully the preventative care as well as the treatments that are being used for your different medical diagnoses. And so, of course, with many elderly patients, Mr. Hall, there's lots of things that we like to educate the patients on when it comes to different community hazards related to fall risks. So some of these may be uneven pavement. So we always try to encourage patients to use like paved walkways or sidewalks because they're usually more steady for patients. Making sure that if your community buildings have lots of stairs, you're using side rails to make sure that you're steady to going upstairs and taking it one step at a time. Don't go too fast, otherwise this can cause dizziness and fatigue more easily. Public transportation, so just being aware of busy streets and having safety awareness there, because of course you want to make sure that when you're moving and whatnot, you don't want to trip or fall into a street on a busy road, because that's a huge hazard for you and drivers. And then lastly, poor lighting within buildings, so making sure that you're assessing the ground and where you're walking on so you can see properly where you're going. And so, of course, for all of our patients, whenever they get hospitalized, we love to encourage different policies that we enact within the hospital to help decrease fall prevention. So from your history, I've seen that you have been hospitalized previously for previous falls and with helping manage your pain for arthritis. So some of the things that we love to encourage for patients as well as for you is to make sure that patients are wearing non-slip socks when they're in the hospital, because we don't want them to trip on wet floors or just the hospital floors in general. Making sure that if a patient is a fall risk, to put a fall risk bracelet on to let the patient know, as well as all the staff who is helping taking care of them. Helping orient patients to their room and showing them the call light system and how to ask for staff if they need help with transitioning from beds to chairs, the bed to the hallway or to the bathroom, or using ambulatory aids, as well as with just making sure that the patient is aware of different mechanisms that we like to use, like hourly rounding on the patients, frequent pain assessments to make sure the patient isn't uncomfortable, and checking to see if they need to use the restroom a ton. One of the secondary diagnoses that increases risk for falls that is very common in many older adult patients is incontinence of bowel and bladder. And that's because if a patient is not able to sense when they need to go or the urge, it can make it more difficult for them to get to the bathroom in time without having accidents. So we like to make sure that we are rounding adequately throughout the day to make sure they're able to go to the bathroom safely and not have accidents. And so I see from your chart that you do have some secondary diagnosis of hypertension and prostate enlargement, which has caused you issues when trying to go to the bathroom, which of course those are important things we always want to bring up, and there's no embarrassment there. And so we would encourage you to, of course, use as much resource in asking for help with the staff. We are always there to help support you. And then lastly, with falls, one of the main things that we try to do with fall education is make sure the patient is aware of the risks and whatnot, and that even though they had fallen previously doesn't mean we disregard that previous fall. It is still as important for a factor when looking at their future fall risk. So that is the end of the fall prevention education, Mr. Hall. If you have any additional questions, I will be here and free to answer them for you.